the long-term analysis after venous stenting. I think that's super important because we are treating young patients and need to know how venous stents behave over time. Hello, my name is Michael Lichtenberg. I'm an interventional angiologist from Arnsberg, West Germany. So one of the topics where we are deeply involved in is venous revascularization. So we're treating a lot of patients with acute and chronic femoral DVTs. And one of our presentations here is the long-term analysis after venous stenting. I think that's super important because we are treating young patients and need to know how venous stents behave over time. And one of the studies we started already many years ago is to analyze the patency rate and effectiveness and safety after venous stenting with the Venous stent from BD. And this paper we're going to present here at Charing Cross this year. So we included 80 patients with different indications: May-Thurner syndrome, acute DVT, chronic DVT, and we followed up these patients over these 8 years. And what we learned is that especially re-occlusions or re-thrombosis occurred within the first 6 to 8 months. So it's typically not an issue of long-term restenosis. It's typically early re-occlusion, and this has something to do with inflow. Bad inflow means venous re-occlusion right after the procedure. So this is what we're going to present, and we had a patency rate of more than 90% after 8 years in our cohort. We had, of course, occlusions within especially the first 6-8 months in patients who had bad inflow. And this is what we're going to present here today. And I think it's important to have these long-term data because young patients need to know about the effectiveness and safety after venous stenting, and this is the reason why we performed this. Thank you.